Hello, good morning, everyone. Thank you for joining us this morning as we talk about returning to work. We are going to give everyone a couple minutes to join us and to get logged in. So just bear with us and we'll get started shortly. Okay, we're going to go ahead and get started. So again, thank you so much for joining us this morning. Today we will be talking about returning to work, streamlining your business reopening. So just some housekeeping items, and again, those of you that have been on our webinars, I'm sure that you are sick of hearing these housekeeping items, so I'll keep it short and sweet. All participants have been placed on mute. You will receive a follow-up email with a link to the recorded webinar and any training documentation. Just be sure to stay updated, register for our upcoming webinars on our COVID page. This training, we hope that you learn a lot, should not be construed as legal or tax advice, but we're glad that you're here, and we hope this is informative to you. One other thing too that I'll go over at the end of the webinar, but that is the return to work checklist. So if you look in your handout section of your GoToWebinar bar, you should see the handout available to you. It's just a PDF file. And like I said, we'll review that towards the end of the webinar, but feel free to grab that and save it. If you have any questions, you want to request training, as always, please reach out to me, training@ctrhcm.com. So today on the line, this is Kara, trainer at CTR, and we're excited to have Bob Florak, President of Acuity HR, on the line. And we will be jointly presenting this today and going through just some stuff that you need to start thinking about if you're not already. So we are now in the phase of opening up America again. So on April 16th, as you know, the White House issued federal guidelines for reopening the economy. And as you know, that's a three-phase state-by-state approach, and they're calling it the White House guidance. So now it's time to think about prepping your workplace and workforce for a return to work. So what we would like to share with you is just planning a return to an in-person workplace operation. And, with all COVID-19 related guidance, just be sure that you're continuing to monitor the developments. This includes federal, state, local officials, as well as your public health authorities. and be sure to consult with counsel for your specific guidance that covers the particulars of your workplace and workforce. So now is the time to plan. So we have been in this time of COVID-19, and now we're looking to plan for post-COVID-19. So you can kind of see, from this diagram here, that while we've been in this, things have sort of slowed down or have been suspended. We've just truly been trying to really survive. I know some of you on the line have had to furlough or lay off employees and suspend a lot of your business, reduce your staff, work remotely. So now things are shifting, and now we are going to a post-COVID-19 time where we need to invest in our people more than ever. We need to start thinking about creating a safe workplace, revise policies, preparing to rehire, preparing to hire, just really focusing on a re-engaged workforce and making sure that it's the right time to reopen, making sure that we're bringing back the right people, making sure that your employees feel safe, and you're doing everything for them to make sure it's the right time to do that, and that you are engaged with them, communicating with them, and really staying in tune with your employees, not to mention keeping up with all of the legislation and keeping everyone safe. Bob, do you have anything to add to that?
Yeah, Kara, those are all excellent points. And one thing I would like to add is, there's a really interesting diagram or illustration, because as we look into post-COVID-19, we are seeing that some of the changes that were thrust upon us in the last 9 or 10 weeks are probably going to be not just intermediate term, but perhaps permanent and lasting changes in the workplace. So we are seeing organizations looking at things like restructuring the way they do their work, and even the people who are doing their work. So it's time to even start thinking about things like job descriptions and some of the permanent changes that will be affecting the workplace.
Yep, absolutely. Thank you. So when can we reopen? So really, you have to make sure that you are checking the local and state directives. You're checking the federal level. The CDC, and probably some of you already know about this, they just released guidance to assist businesses in making decisions regarding reopening. And the guidance directs that businesses should not reopen unless they can answer yes to these 3 questions. And those 3 questions are you in a community no longer requiring significant mitigation or restricting operations to designated essential critical workers? The second is, will you be able to limit non-essential employees to those from the local geographic area? And the third question is, do you have protective measures for employees at higher risk? Teleworking, example, tasks that minimize contact. The CDC also goes on to say, even if companies are able to answer yes to those 3 questions, they do recommend that businesses remain closed until they can implement safeguards to combat the spread of COVID-19. And the safeguards that the CDC is saying that you need to have in place, the use of healthy hygiene practices, intensified cleaning, disinfection, ventilation, social distancing protocols, and we'll get into a little bit of this a little bit later in the presentation. Telework, cancellation of non-essential travel, seating distance of at least 6 feet, and staggered gathering, starting and closing times, restricted use of any shared items or spaces, and training all staff in all of the safety actions. So again, the CDC guidance based on those questions, even if you can't answer yes to those questions, they want to make sure that you are prepared to be safe and to keep your employees safe.
And Kara, if I can add, this is probably one of the areas that's the most confusing to many businesses right now, because I know our listeners are from various states. We're in Western Pennsylvania right now. Pennsylvania has done a very good job of coming out with some of the guidance as far as specific levels, meaning red, yellow, and green. What they haven't necessarily done is put together some of those regulations and some of the things that coordinate with the CDC. So as you know, for example, in Western Pennsylvania, we'll have all but one county that's returned to the yellow phase, or will be returning soon to the yellow phase. However, we are hearing from district attorneys that they're not going to be pursuing action against businesses who do open, either in violation of the considered phases or even going beyond some of this guidance. So a lot of this is incumbent upon us, is not just, you know, when can we reopen, but how we can reopen. And the how is probably the most difficult part right now for anyone to get specific guidance on.
Yeah, thanks for mentioning that. And I did see, you know, like Bob said, we're in Pennsylvania right now, and I did see, you know, a local district attorney saying that, you know, the city police and the local district attorney would not prosecute businesses that are open, but yet our governor is saying, you know, we will revoke liquor license, we will do this if you don't comply. So it is super confusing. So along with that, just establishing ongoing monitoring protocols, and you can take a look at some of the things the CDC is saying. And again, we'll get this presentation out to you. But having sick employees stay home, establishing routine daily employee health checks, monitoring absenteeism, making sure that you have flexible time off policies in place. And that's one of the big things that we'll talk about today is, you know, making sure that you're in compliance with your paid time off, and not only taking into consideration the Families First Coronavirus Relief Act and making sure that your policies fall in line with, you know, that paid sick time and that extended FMLA, but also just reviewing your time off policies in general. And how you can customize those to make sure that you keep your employees safe and also keep your business going. Have an action plan in place if an employee or worker tests positive or presumptive positive for COVID-19. Creating and testing emergency communication channels for employees, establishing communications with state and local authorities. You know, we always talk about, especially, you know, in leadership and in training, how important communication is. And I think now more than ever, to over communicate is the best strategy at this point in time. Bob, anything to add here?
No, Carrie, covered it well. Again, a lot of one of the recommendations, what we're seeing with a lot of organizations, is the when can we reopen question is something that should be considered at the management and executive level. And even we talked through the process of coming up with some documentation around developing and documenting why you opened and having that become part of your, more or less, your COVID history, so that if there is ever a question why you chose to reopen, you have some justification for doing so.
Okay, so let's get into recalling employees, and you know, what is important to think about with recalling employees. How are you going to do it? What questions do you need to answer, and what practices do you need to have in place in order to do that? So Bob, do you want to take this slide?
Sure. Yeah, thanks, Kara. Yeah, so recalling employees is where many of us are at right now. Again, during the last few weeks, people have maybe brought folks back informally, formally, even on a part-time or a modified schedule basis. In some cases, even employees didn't leave the workplace, or were working remotely. So recalling employees is a very general term. In some cases, we're going to be recalling employees from unemployment, meaning that they're no longer on a W-2 basis with your company. Some will be recalled back to the physical workplace. So we asked the question, what communications needs to be happen before you bring employees back? One of the recommendations and best practices that we're seeing is, again, documentation in the form of an offer letter or a re-onboarding letter to employees to explain to them what their current work situation is going to be whenever they return. It's very similar to an offer letter where we'll be stating to the employee what the expectation is as far as hours, what the expectation is as far as pay even, because again, some folks have gone through pay reductions, if there's a reinstatement of benefits, including some of those things. So we do encourage using that letter, and that letter serves a couple of purposes. One is if an employee were to go forward and try to maintain their unemployment compensation, because that's a general question we hear an awful lot. How can I get my employees back from unemployment compensation? Generally speaking, not specifically speaking, but generally speaking, if work is available, or in the case of someone who's on a PPP loan, if pay is available, meaning reinstatement to the W-2 status, but not even necessarily coming to work, generally then that may disqualify an employee for eligibility for unemployment compensation. So the letter is proof that you offered the employee to return, and also then serves a purpose of some of the expectations that you're going to have as far as things like, we'll going again talk about in a little bit, like teleworking and hours of work, changing shifts, that type of thing. Who should return in what order, which employees come first. That's a tough choice, but it's a business decision. The one thing we say is when you are returning employees back to the workplace, think through the business case. The business case is usually the right case, and as long as you follow a very specific and well thought through rationale for how employees are going to return, follow that rationale. Again, documentation, understanding, because some employees, for example, may not want to come back to work. Some may be questioning why I wasn't chosen to return to work. And in some cases, you may be bringing your full-time people back as part-time. You may be bringing them all back. But again, how should you choose those? As long as you follow a standard. And remember, the laws still apply. EEOC laws still apply. So we want to make sure that we're documenting and we have no adverse impact against any of the protected classes. As far as remote work is not only can you do it, many of the regulations, as we see from the CDC and the state guidance, are encouraging remote work. And in some cases, they're even saying if remote work is feasible, it should be maintained. Again, that's language we see here in Pennsylvania. In some instances, you may have split employees. You may have some returning to the workplace and some not returning to the workplace because they can work remotely. So for example, if someone is in a critical position where they have to be in the location, maybe only 1/3 of your employees are returning to work. Some best practice we're seeing is almost a redefinition of the job description for folks as they're coming back into the workplace, to let them know why they've been chosen for remote or on-site work. And again, if we try to rehire an individual, bring him back from furlough, temporary layoff, we talked about that a little bit already with unemployment compensation. There are some caveats to that, so we have to be careful. And I've heard some attorneys giving guidance, and I'm not an attorney, so I can't give legal guidance. So just parroting back from what I've heard, we have to be careful that we do remain in interactive dialogue with employees, and we discuss their ability to return to work and how that would, and again, keeping some sense of documentation and working through if an employee refuses to come to work, because generally a refusal to return to work, if you don't have a valid reason, will preclude you from unemployment compensation. Thanks, Kara.
Yeah, thanks, Bob. And as we talk about some of these things, we'll be letting you know how you can use iSolve to stay compliant with this. So with recalling employees, you can use employee messages or the mass email tool in iSolve to communicate with your employees. If you want to learn more about that, we did do a webinar on that, and that is on our website. So that is a nice communication tool, especially in the event of everything and you have employees working remotely. You can simply do that in your electronic self-service or employee self-service. So workplace safety. So let's talk about this a little bit. It's no surprise you've seen this, and we've talked about this. Deep cleaning before and ongoing scheduled cleaning. We want to make sure that we are doing this both as a containment measure and to help employees feel more comfortable about returning on site. Containing employees to a specific area. If you have a skeleton crew in the workplace, try to contain those employees to a specific area while the deep cleaning process is in place and is underway, so that occupied area can be cleaned immediately prior to your additional employees returning. Remove food from common areas. So if you have food out in your break areas or kitchen areas, just remove that. You don't want people sharing food. Require infection control practices. So you may need to schedule daily, weekly deep cleans after employees return. So you have to be thinking about that and make sure that you're strategic. A deep clean is also advised whenever an on-site employee reports being positive or presumptively positive for COVID-19. You should also think about providing disinfectants throughout the workspace for employees to use and wiping down surfaces. And this is something that you want to make sure that you communicate, what is required from your employees. It's not just on you. So you want to be thinking about everything that goes into the deep cleaning. And as Bob said, things are different from state to state. I know in Pennsylvania, for example, Pennsylvania is requiring that areas visited by a person who is a probable or confirmed case of COVID-19 be closed off with exterior windows open for ventilation for a minimum of 24 hours. So just be cognizant of, implementing any cleaning protocol that you're reviewing the latest guidance provided by the CDC and OSHA, and that you're following those state and federal guidelines.
Yeah, Kara, it's interesting with workplace safety. Obviously, for those on the call who are in the construction or manufacturing business or physical labor business, safety has been a primary concern for a long, long time. But for now, every organization has to start thinking about workplace safety because it's kind of been thrust upon us with what's going on. So if you don't have a safety person designated in your company, it might be time to think about designating that person and putting someone who is in charge of these safety protocols, even working with a safety consultant or trying to get some specific industrial hygiene guidance. Because some of the things, we've been hearing things as basic as safety consultants are recommending removing your coffee pot, just taking it out completely right now, even if it's a Keurig, because what's going to be the cleaning protocol to have someone go around and wipe down that machine, and what if someone doesn't after they use it? Same way with, like you mentioned, we all like to do nice things like bring in snacks and birthday cakes and that type of thing, stopping or curtailing that. And again, one of the recommendations we're seeing an awful lot is communicate these in policy, write them, give them to the employee, including signages. For example, in your break rooms and, for cleaning protocols, remind people of the cleaning protocol. For example, on your refrigerator, you may have a sign that says, after removing your lunch from this refrigerator, please wipe down the handle with sanitizer, whatever the situation might be. So it's actually forcing us to go a little bit deeper than we probably ever thought whenever we get into safety, and a challenge for lots of our companies.
Yep, absolutely. So just some more on workplace safety that, we've been seeing some questions on this, and I know Bob has fielded a ton of these. But just a couple things to think about other than communicating and making sure that, your employees are safe. You want to make sure that you're proactive in determining how you're going to answer questions that come up. And one of those questions that we've been seeing is, what if an employee is concerned with another employee's presence in the office because the employee is exhibiting COVID-19 symptoms? A lot of employees are going to be have fear and anxiety about returning to work. And then when you have someone exhibiting COVID-19 symptoms, that fear and anxiety is even raised up a level. So, any employee health concerns should be directed to HR or some other single source, such as employee health and safety. You want to, like Bob said, make sure that you have a policy in place for protocols for employees in this situation. Plan. Be as proactive as you possibly can. You should also be aware whether paid sick leave laws in your jurisdiction allow for time off due to concerns related to contracting COVID-19. And that's even for workers who are asymptomatic and have not been in close contact with someone. It's a reality that we're faced right now, and we have to be prepared for that. How should employers define close contact when determining if an employee was in close contact with someone diagnosed with COVID-19? So the CDC has defined various community exposure possibilities on this, naming close contact, and how they've defined close contact is 6 feet or closer for a prolonged period of time. However, they have stated that, the data that they have is limited to define close contact. As an employer, you should consider factors such as proximity, the duration of the exposure. So, for example, longer exposure time likely increases the exposure risk, whether the individual has symptoms. Again, example on that, coughing likely increases exposure risk, and whether the individual was wearing a face mask. Again, the CDC has also stated that, the data is insufficient to precisely define the duration of time that constitutes a prolonged exposure. Everyone is kind of in this together, and we're sort of learning as we go, and no one's truly the expert on this. It's an unprecedented time. So that's why, I just recommend you keep checking out our webpage, make sure that you're staying up to date with the CDC and OSHA and the resources, and we'll provide some of those to you as well. And just the last thing on here is keep OSHA's issued advisory guidance in place. The OSHA Act requires employees to provide employees with a workplace free from recognized hazards that are causing or are likely to cause death or serious physical harm to employees. They have issued advisory guidance on preventing exposure and preparing workplaces for COVID-19 that can assist employers in returning to work. And we will give you some resources at the end of the presentation and some links to make sure that you're following just on a daily basis. And I think Bob mentioned that you may want to just designate, if you don't already, designate a person or a task force that is responsible for this in keeping up with the compliance and communication to your employees. You can also use iSalt to do OSHA tracking, to stay compliant, and you can produce your OSHA reports right out of iSolved. Anything to add to that, Bob?
Karen, just a point of emphasis, and you touched on it, is that the CDC has given guidance, but it's very hard to get that specific, to bullet number 2, how should we define close contact? The CDC has given some guidance, as well as some of the state and municipalities have given guidance. I think you mentioned earlier about Pennsylvania and the statement about ventilating and cleaning. There's probably another consideration too, and this is the one we're seeing. If you haven't had a COVID case in your organization yet, if it does occur, if and when it does occur, a lot of the things we see as guidance kind of go out the emotional window. So that's when employees will respond and be prepared for things like saying, well, I didn't work with this employee, but I worked with someone. It's that contact tracing. So there has to be a bit of an emotional response that goes into it as well. So having that preparatory guide ready so that if you do have an exposure or a probable exposure in your workplace, you can immediately communicate and calm some of the fears of the other people in the workplace who don't fit some of these more defined requirements as we see from some of the guidance. Thanks.
Absolutely. It's just so fluid, and I know we've kind of said this in all of our webinars, but that we're kind of just all taking this, minute by minute to keep up with everything. It's truly information where we are on overload and overwhelming. So that's why it's important now more than ever to really just appoint someone or a task force to keep up with everything. So some more on workplace safety. So we're going to talk about social distancing measures and personal protective equipment. And again, this, it goes by your state and federal guidelines. Each state is a little bit different in what they're requiring, and also your local jurisdiction. So you'll likely want to implement social distancing. So limiting the number of employees per floor. If you have multiple floors or multiple workspaces, just spreading out those workstations to allow more space between your employees. Think about reducing the number of employees that are there at one time. If you can do staggered shifts, if you can have, some people work in the morning, some people work in the afternoon, at night, or create multiple shifts, go ahead and do that. Implement one-way hallways or paths so that you don't have your employees needing to walk past each other. Plan for that. Limit the number of employees allowed in your elevators or your bathrooms at any given time. Assign time slots for each department to visit any type of break room or coffee station. Again, Bob mentioned, just taking that out completely. And that might be a safeguard, and that might be a step that you choose to take. But if you don't and you keep that in, just be prepared to limit the number of employees at that station, put your safety protocol into place, and make sure that you communicate that. And in addition, the CDC does recommend that you may want to designate certain individuals as community managers or floor contacts, so that if you have different floors, that you have a floor by floor management in place. These employees could serve as the point of contact for, a certain workspace area or floor. They could monitor the protocols. They could be the ones that are suggesting improvement based on observations and feedback that they hear and see from others. And you also, and Bob touched about the emotional piece of this too. You may want to consider ways to make the workplace feel more welcoming. At least initially, the workplace is going to feel empty, awkward if fewer employees are present. It may help reduce the stress and anxiety that people are feeling just by making sure that it's you do some things to welcome your employees and to make sure that they that you're thanking them, and that that safety is first, so that they feel more comfortable coming back to work. Personal protective equipment. So one of the things that we have seen asked on some of the SHRM boards, HR boards, is, can employers require the use of PPE or personal protective equipment in the workplace? So during a pandemic, the general answer to that is yes. But you want to make sure that you review what is being required and or recommended by the CDC, as well as, federal, state, and local government mandates. I know for us in Pennsylvania, Pennsylvania is requiring that employers provide employees masks to wear, and that they require employees wear masks during work hours. And I know, other states are doing things differently. So it's really important to keep up with that guidance. Bob, do you have anything to add to that?
I do, Carrie. Yeah, these two items on this page, social distancing and personal protective equipment, probably some of the biggest tactical challenges that we're seeing in the workplace right now, because again, it's very difficult sometimes to get specific guidance from the federal government or state or municipal governments on what these titles or what these topics are, but they'll mention them. For example, I would say as far as PPE and masks, that regardless of where you have a work location, you could probably go out and just Google mask requirements for the city even that you're in, because we see so many differences across, the CDC, again, federal government, pretty easy to understand, but states, municipalities, even at the city level, they're going to talk about what PPE is required. And then we have situations where some employers are not enforcing it, others are. So an employee will come forward and say, well, wait a minute, they don't wear a mask over at ABC company, but you're requiring me to wear a mask. Or even within certain operations, we'll find situations where people come forward and say, wait a minute, over in the other department, they're wearing masks, but we don't have to, and I'm fearful. So something is worth addressing and understanding and setting your policy and then working towards enforcement. Enforcement doesn't always mean discipline either. Enforcement just means the interactive dialogue, that coaching folks through what your PPE requirements are, what your social distancing requirements are, and how you're going to enforce it. And the best way to do that, train your managers, because it's very difficult. If you're an HR person on this call, you can't be all places at one time. And if you're an owner or a CFO or someone who's responsible for the overall operations, you can't be all places at one time. So it's developing those protocols, communicating the why, and then making sure that people buy into it. So again, as you mentioned, Kara, emotional issue, but one that also does have some exposure and risk for organizations who don't follow it. And then perhaps if you did have an outbreak and someone were then to either file a workers' compensation claim or beyond, it's pretty difficult if you don't have some sort of sense of what you communicated to your employees and how you held them to the standard.
Yeah, absolutely. And another thing is just to remove obstacles for your employees. So if you have employees that have to fill out paper right now to make changes, personnel changes to their address, or anything like that, remove those. Remove the paper. Use employee self-service and iSolved. That way, you're encouraging employees to make changes online, and there's no paper, and that limits the exposure for everyone.
Absolutely. Good point there.
Just some other considerations. So in-person meetings, you want to make sure that you're avoiding those as much as possible. Teleconferencing may be used by site essential staff, provided they're dialing in from separate areas. Avoid in-person meetings as much as you possibly can. And if you do have to do an in-person meeting, just make sure that you're really limiting that. You should be limiting that to a maximum of 10 people. Make sure that if you have to hold that meeting, that your attendees have a mask covering their nose and mouth, and make sure that social distancing is in place, so that distance of 6 feet should be maintained. You also want to increase physical space between employees and customers. We've been talking a lot about your employees staying away from each other and maintaining that social distance. But you also want to make sure that you're increasing physical space between your employees and customers. So, if you have a drive-through, or if you're working with customers and they come into your location, have a plexiglass partition. The next point there is deliver services remotely. And that, if you, like we're doing today, if you provide training, if you provide any type of service, try to do it remotely. If you can accomplish it via phone or video or web, do that. If you are in the business of delivering products, do curbside pickup or delivery when possible. We also talked a little bit about this earlier. If you have the possibility to implement multiple shifts, do that. Utilize nights, weekends to spread out work schedules and provide social distancing. Maybe if you have 1 or 2 shifts now, try to move to 3 shifts. Keep each shift with the same people each day. That way if a person on one shift becomes sick, workers on the other shifts, are protected. And this may also accommodate, shifting childcare schedules for people that, are still have children at home or their daycare center is closed or, they're home from school. So we also want to be conscious of that and making sure that, we are there for those employees as well.
Yeah, Kara, some of the things we're thinking out under this concept of other considerations. Again, we all were kind of forced into action. None of us had time to think, plan. We had to react. Now we may feel that we have a little bit of time to plan as we think about reopening or re-engaging or moving back to, some sense of what the next few months are going to be. But consideration as we think about things like, changes to the workplace, again, some of these may be long term. That, again, it's not necessarily because we're going to overreact, but we want to make sure that we contain the spread. We want to make sure that there might be situations where we're dictated or mandated to do some of these things long term. So as we look at something as simple as remote work or delivering services remotely, starting to think through, yes, how is this going to work for the next 60 days? But we might also think about how this is going to work for the next 6 months or maybe even beyond. Because, again, I'm not a scientist, but looking, are we going to have a U-shaped curve, a V-shaped curve, a W-shaped curve as far as the economy and the spread of COVID? And of course, those two things go hand in hand. So as business leaders, we should start thinking about, again, not just how is this going to work over the next few months, but what if we're still thinking about this, God forbid, next year at this time?
Yeah, good point, Bob. I think I heard someone say the other day, business as usual, and I said, I don't know what that means anymore. I don't, is that even a thing anymore?
I think that business as usual is TBD, to be determined. We'll see what that means. I don't think any of us know right now.
Absolutely. Okay, so this next slide I'm not going to go through. We're about it's 11:42 and we have a lot to cover. So I'll keep that in there and you can look at that. So going forward, let's talk about testing and monitoring. So, again, this is something that you have to make sure that you are following state, federal, and local guidelines. Can an employer screen the health of its employees? Yes. The CDC and state or local health authorities have acknowledged the community spread. They have issued precautions. They have done this. They did this in March. Employers can measure employees' body temperature. They should notify their employees or temperature screening measures in advance. Make sure that you're informing your employees that the purpose of this is to solely, protect employees by keeping individuals with symptoms consistent with COVID-19 off-site. And it's not to determine if an employee has any other illness. Messaging should be made clear about that, that it's not intended or it's not a substitute for any type of clinical diagnosis. And employees and employers should note that the CDC did add new symptoms to its list of possible COVID signs, so make sure to check that out. Can employees administer COVID-19 tests before permitting employees to enter the physical workspace or workplace? So it was April 23rd that the EEOC updated its questions and adopted the position that given the current pandemic status that we're in, employers may test employees before they enter the workplace to determine if they're infected. However, you want to make sure that, and this is tricky because you want to make sure that you're complying with ADA standards, or ADA standards. Or employers, excuse me, have a responsibility to ensure that tests administered are accurate and reliable. So you want to make sure that you are following the EEOC guidelines on this and what's considered safe and accurate testing.
Yeah, and the only thing I'd add to that, Kara, is what we've already talked about: consistency and confidentiality. Treat everyone the same and protect the HIPAA data, because those rules still apply.
Yes, thanks, Bob. What procedures should employees or employers put in place for employee health screening at work? That is included in the notes in this presentation, and we'll get this out to you. And we're going to just keep on trucking here. So next slide. What if an employee has a temperature or otherwise presents COVID-19 symptoms? So if an employee has a temperature, it's best to confirm that temperature with a second test. Make sure you're doing this in a confidential manner to consider any explanation the employee may offer for that temperature. And it is reasonable to send an employee home who has an elevated temperature. The CDC guidance on that says 100.4 or higher. Can employers implement screening protocols for customers or workplace visitors? Yes, and that I've already seen, some businesses, at least around here, that have already been implementing that. Anything to add there, Bob?
No, doing well, Kara. Good.
Okay. Positive test protocol and contact tracing. So, you're doing all of this work to make sure that you're keeping employees safe. You want to make sure that you have a communication plan. You want to do contact tracing. So you want to have a record of who is in different areas of the workplace. That way, if you do have someone that is presumptive or tests positive, that you have the ability to contact those that were impacted, and that you're keeping, everyone safe by putting those protocols into place. Reviewing employee policies. So again, now more than ever is the time to review employee policies. Bob, do you want to take this one?
Yeah, sure, Kara. The policies are important. I think we've got a lot of work ahead of us as we're moving into return to work. Thinking about your existing handbook or some of the policies that you have, we don't necessarily have to throw those out. Some of them are going to be augmented, some of them are going to be adapted, some we may come up with additional policies that we overlay on top of that. For example, sick. I just had this conversation with someone this morning. They were saying it's kind of odd because in the past we had a points program and we would give people points for calling in for excessive absences. Now we don't want to force them to come to work if they feel sick, and that's exactly correct. You still have to balance your workplace. You still have to get your job done. So you want to put some of this into policy. For example, how are you going to handle a confirmed case? How are you going to handle probable cases? How are you going to handle people who might feel that they are sick or have that elevated temperature? It's 100.4 is the CDC, but if someone called up and said, I have a temperature of 100.3, are you going to tell them you better come to work? So some of this is, again, policy. Some of it is philosophy. But our recommendation now is to devise it, to open up your minds and think about things like, under the FCRA, the Family First Coronavirus Response Act, we do have to communicate those policies. So we want to make sure those exist. But some of our other policies, like our existing sick leave policies, looking at that flexibility. And again, it's just some of our other policies in the workplace. And some of those policies are as basic as tools and things that people bring to work. If you're an organization where employees were supplying their own tools, are you going to make them clean their own tools? Talk to them about sharing their own tools, putting that into your equipment policy. And it may even be as far as your PPE policy. If you allow an employee to provide their own face mask, what is the cleaning protocol for that going to be? So it really opens up a complete world of policy. And I hate to be kind of that overwhelming guy. You'll pick and choose what needs to be done in your workplace, but it's definitely a consideration. Everything from safety, security, and ongoing operations. We need to consider that right now and come up with those policies.
Thanks, Bob. The next thing to discuss is remote work considerations. Like Bob said earlier, that is truly being encouraged. If you can keep your employees working remotely and that's working for you, do so. That's the main advice and guidance being given. Bob, do you want to take this one?
Sure. Yeah, as we look at remote work considerations, some things that you should think about first, again, analyzing who can do it, as we talked about on an earlier slide, who can do it, who can't do it, and who are some people who might be able to do it, and working through those different situations and understanding, is it going to be permanent, and never using the word permanent, of course. Nothing is permanent. It might be, and some organizations are doing this. They're coming out with early declarations and saying, while the state may allow us to return to work on June 1st, right now we don't plan on returning most employees prior to June 30th. So it's using those types of considerations. That second bullet about costs, and costs go both ways. One of the business cases for remote work is some of the things that we've already talked about, as far as providing PPE and doing temperature screenings and cleaning and maintenance, and even like the cost of hand sanitizer right now. If you have to buy hand sanitizer for all of your employees in the workplace, it's a considerable expense right now. One, because it's so hard to find, you may not even get it. Two, if you do find it, it's going to be about 3 times the price it was whenever you used to go to local CVS and buy it for 99 cents in a pump container of 12 ounces. So some of these are business cases around expense. Some of them, though, are also around maintaining good safety and hygiene. Now, whenever we do require employees to work from home, do we have to pay for some of these things? You don't necessarily have to. For example, if an employee has internet access, it's probably not costing them anything additional for the internet access. They may be bringing your computer home, but again, a lot of this is the business case, doing what's reasonable. We don't want employees feeling like it's costing them more to stay home, while in fact, in most cases, if an employee is commuting, whether it's public transportation or private transportation, it may be more cost effective. And in some cases, we're actually seeing a high productivity increase when employees are working from home. So do we have to allow an employee to work from home after we've been reopened on our work site? That's a big depends. It depends if there is a compelling reason why they have to. Remember, the Family First Coronavirus Response Act still applies. So if there are reasons why an employee can't come to work due to a quarantine or a school closure, their own illness, if you're covered under family medical leave because you have more than 50 employees, there might be qualifying events under there. So we may look at that as an accommodation even under ADA. So do we have to allow an employee? Sometimes it depends. It's case by case. And if an employer wants to gradually bring back employees to the office, as we talked about earlier, could they bring those back who have a lower level of remote productivity first? The answer is yes. And could that be seen as discriminatory? Not if you need to take your mitigating factors into consideration. Again, why did you recall this employee? Have the notes, have the rationale, have the ability to defend whatever that you're going to present as that rationale. So remote work is going to be something we're going to deal with for a while. And again, I keep mentioning policy. It's not a bad thing to have your remote work policy communicated to your employees. For example, if you expect them to work from 8:30 to 5, defining what 8:30 to 5 is and defining what work is. You can't walk the dog for a half hour at 2 o'clock in the afternoon unless that's your vacation or your break or your lunchtime. So it's kind of reimagining the way we treat people in remote work. Thanks, Carol.
Thanks, Bob. And just a note on this, we did do a remote work webinar, and you can check that out, the recording and presentation out on our website. So hiring and HR compliance. So we're gonna jump through these. We're running short on time. We have so much to cover. So we're just gonna run through these. Hiring is on here. These these answers are on here. I'm going to skip through them and get this sent to you. Just a quick thing about hiring. Just make sure that you are updated on the new I-9 guidance. There has been, the USCIS has issued guidance that is temporary guidance for the pandemic, just on how you can document remote workers, and even more so, something else just recently came out about if people don't have the ability to update their driver's license or their photo ID because that place is closed, what to do in that case. So be sure to check that guidance out. HR compliance. So are there any steps employers should take to address workplace harassment related to COVID-19? And this is a big one. You want to make sure that you're reminding all employees that it is against the federal law to harass or otherwise discriminate. And I've seen a couple states already come out with laws regarding this. Bob, I don't know if you want to talk about that more.
Yeah, I think it's the same statement we had before about confidentiality, and the laws still apply, and in some ways more so than ever. So people will be looking for situations where they might feel they are being discriminated against. So just remember, all laws still apply.
Thanks, Bob. Some more HR compliance. So again, the answers are in here. I'm going to keep going and provide the presentation to you. Where must employees store on-site medical examination results? Remember, ADA requires all medical information be stored separately from the employee's personnel file. Other considerations, just really, again, follow the CDC recommended steps. If you have an employee that is exposed or diagnosed, if you have employees that are symptoms, the CDC has guidance and advice on all of that. Other considerations, and we briefly mentioned this earlier, but the importance of employee support channels. Ways to consider how employees can seek clarification, how they can voice concerns, or ask for exceptions to certain procedures. Again, people are going to have fear and anxiety, and we want to make sure that employees feel safe and emotionally and mentally well. If you have an employee assistance program in place, remind employees about the availability of that, remind them how to locate resources. We've talked about this throughout, but clear communication and just, encouraging your leadership to remain flexible and to work with employees to develop interim solutions. Benefits. So what should employers be considering from a benefit standpoint when returning to work? A variety really of benefit issues, starting whether, if you're rehiring someone or if it's a new hire for purposes of your various benefit plans and plan notices. You have to consider, was the employee actually terminated? Were they placed on furlough or leave? Was it paid or unpaid leave? What the applicable plan documents say, how long the employee was not performing services. So the answer is going to differ depending on the type of benefit plan that you're talking about. One of the most important things, for your benefits for working with iSolved is that you're making sure that you're keeping track of the status of the employee and that history is clean. And you also want to make sure that if you're dealing with COBRA, that you're utilizing the plans in place and the termination reasons in place that trigger that COBRA. If you have any questions on this, definitely reach out to Tracy Frazier at CTR, and she'll be happy to help you with this. Tracy also just did a webinar for us, considering all of the benefits related to COVID-19, what to do, how to do it in iSolved, and that recording is up on our website. All right, we're in the home stretch, so I know it's noon, so we're gonna kind of hurry through this. I appreciate those of you staying on and sticking with us. So business continuity plan, you know, it's a plan to maintain functions during an outbreak. If you don't have one, now is the time to do that. Communicate, document. Start with 4 questions. You know, how are we keeping our employees safe? How can we ensure that mission critical tasks get done? How can we continue to work with suppliers? And what's our communication plan? You know, and this just talks to you about what we've already talked to you about, you know, appoint a pandemic manager or a task force, create a succession plan. You know, key leaders or people on your task force, you know, they might get sick for a day, a week, a month. You know, make sure that you develop a plan and distribute it widely so everyone's on the same page and they have bought into the plan. And if possible, you know, mandate work from home. Again, that's what we're seeing is if you can continue to work from home, do so. Anything to add, Bob?
I'd like to emphasize that succession planning. It's important because, you know, as you mentioned, the risk of illness, but we also are seeing an interesting dynamic. There is turnover in the workplace. Folks are leaving organizations, they're getting hired by other organizations. And I would imagine if a key employee in a key role from either your current operations or to assist through some of the pandemic response were to leave, transition to something that would have been a closed source, meaning they didn't share with other people, would be increasingly difficult right now. So ask a lot of questions and document as much as you can.
Okay, so return to work checklist. So again, in the handout section of your GoToWebinar, we did add a return to work checklist. So I'm just going to quickly bring that up. So you can see this is a checklist for you to just check it off as you go. Workplace safety, recalling employees, your communication plan, how to stay in compliance, remote work, compensation, and employee benefits. If you have any questions on that or the webinar, just please feel free to reach out to me. So let's continue here. So exciting announcement. We are here for you. And for those of you that are on the call and have been on past webinars, you're familiar with Bob's voice. We have teamed up with Acuity HR to help you. You know, we have been on calls and emails with you, and, you know, we have supplied your payroll and ops, but, you know we need to do more. There's a whole new world of compliance out there, and we want to make sure that we have that level of HR support for you. So we will be offering with Acuity HR 2 levels of service. We'll be offering tactical HR as well as strategical HR. And Bob, I don't know if you want to talk about this.
Sure, yeah, I'll go through it briefly because I'm aware of our time, but we're very pleased to be working with CTR. We've known them, the organization, for many years, and we share mutual clients and probably best and most importantly, a mutual approach to the way we work with our clients and value their businesses more so in many cases than we do our own. So from a HR standpoint, we really look forward to working with and providing services through CTR in 2 levels: a tactical HR support, as Kara mentioned, which as it sounds is a very direct service, whereas, and I won't read all of these, but if you look through it, it's providing resources, both now in COVID-19 and beyond, with things like forms and help and assistance with your HR questions. If you have them, you call we answer the question, we walk you through the situation, and we provide you real world services and real world products to address it. And for those of you who are HR people, if you work with us, we do provide some trainings, and those trainings you can get HRCI or SHRM credits for your CEUs to maintain your certifications. And at this level of service, again, what we do is we become kind of that nuts and bolts HR. And then if you can jump over to the strategic, Kara, this is a little bit higher level service. And what this is where we work with organizations to go beyond the tactical and work on things like linking HR practices to your business, whether it be performance management, compensation management, onboarding, developing custom solutions that fit, again, into your individual situation. We've been in business for 15 years. We've been working with lots of different organizations, and we're pleased to offer both a tactical solution and a strategic solution that could benefit, again, not now, just, and I think this has escalated to how important HR is in the last 9 or 10 weeks, but on a going forward basis that we can help with aligning your business practices with your HR practices. Thanks, Kara.
Thanks, Bob. And yeah, just from working with Bob and the short time that I have, I've already learned a lot, and he's already been super helpful to me. So really excited about this and what you're going to be able to provide to our customers.
Great, thanks, Kara.
So yeah, now is the time. If you're interested in these services, just contact us. Send me an email, training@ctrhcm.com, and we'll walk you through, an HR consultation. We'll talk to you about where your business is at right now, and what policies, procedures you have in place, and talk about the future with you and what we could provide. So real quick, we have some resources in here for you. And again, I'll get this presentation out to you so that you have it. Upcoming webinar, we have an upcoming webinar on Friday. We'll do a town hall, do Q&A. You can ask your questions during the town hall. You can send your questions to me now. So join us for that. You can register on our website. Again, that's Friday, this Friday from 11 to noon. So thank you again for those that have stuck with us. I know we ran over a little bit. I appreciate you being on the line and staying with us. And from all of us at CTR and Acuity HR, please stay safe and well. Take care, everyone.